Youth Week. Good evening, everyone. Happy Youth Week. My name is Gifty Otang. I want to first thank you all so much for your time this evening to listen to this presentation. As Brother Felix mentioned, stress and anxiety does not discriminate. Any age, anybody at any age can struggle with that in life. So hopefully you gained something from this. We wanted to do this presentation specifically because we have a lot of the youth members in school, especially high school and college, and we know that that comes out with a lot of stress. So hopefully parents, if any parents are on here and your children were not able to join, you can provide any of information that you gained from this and share it with them. We will also provide a PDF or PowerPoint copy for anyone that is interested in having a copy of your own. So let's dive in. Managing stress and anxiety. Some strategies for success in life, school, and work. Stress and anxiety are common experiences, as I mentioned. They can impact our well-being and productivity. This evening, we are going to talk about some strategies to effectively manage stress in life, in school, and in the work setting. Understanding stress and anxiety. All right. How do we define stress and anxiety? I hope you can see the screen. Stress is a response to external pressures or demands. And oftentimes it's triggered by situations like work deadlines or personal conflicts. Anxiety, on the other hand, is a persistent feeling of apprehension or fear about future events. This can be accompanied by physical symptoms, like your heart rate can be racing, you'll start sweating. While stress is typically a reaction to specific events, anxiety tends to be more generalized, and anxiety can persist even when the stress is removed. So it can just keep going on, even when whatever is stressing you out is not there anymore. Common causes of stress include school or work pressures, as I mentioned, financial difficulties, relationship problems, major life changes, starting a new job, moving. So many things can cause stress. Health concerns or time constraints. Anxiety can be triggered by similar factors, but anxiety may also arise from predisposition, traumatic experiences, genetic factors, or chemical imbalances in the brain. Additionally, social anxiety can stem from fear of, from fear of judgment or rejection in social situations. Next slide. Yeah, this is kind of small, but you can zoom in from your screen if you need to. Let's talk about healthy versus unhealthy stress. Healthy stress, also known as eustress, is a positive form of stress, and that can motivate individuals to perform well. It can also improve productivity and enhance overall well-being. Eustress is often associated with feelings of excitement and fulfillment and a sense of achievement. It typically arises in response to challenges that are perceived as within one's ability to handle, such as maybe you're starting a new job or you're taking on a new project. This type of stress can improve focus, energy, and performance, and it's typically short-term. Unhealthy stress or distress, as we call it, on the other hand, is a negative form of stress that can lead to physical and mental health issues. It occurs when stressors are perceived as overwhelming and unmanageable. So distress can be caused by chronic problems such as financial difficulties, job insecurity, long-term health issues. Some symptoms of distress include anxiety, depression, irritability, physical ailments like headaches, your blood pressure will go up, high blood pressure, and decreased performance and motivation. Prolonged exposure to distress can result in burnt out and other serious health conditions. So let's summarize. The key difference between healthy and unhealthy stress lies in their impact and perception. Healthy stress is motivating short-term and perceived as manageable, while unhealthy stress is overwhelming long-term and perceived as beyond one's control, leading to negative health outcomes. Okay, next slide. Let's talk about some impact of stress and anxiety. It can impact your physical health, and it can lead to sedentary lifestyle, obesity, lack of physical activity, contributes to weight gain and obesity, cardiovascular health, increased risk for heart disease, hypertension, stroke, and then for the musculoskeletal problems, weakened muscles and joints leading to conditions like osteoporosis. And then poor nutrition is another way that it can affect malnutrition. Both undernutrition or overnutrition can cause significant health issues. In addition, diabetes, high intake of sugary foods can lead to type 2 diabetes. Heart disease, diets high in saturated fats and cholesterols can increase heart disease risk. In addition, substance abuse, impact of stress and anxiety. Some people may tend to use substances to manage that. So, and substance abuse leads to liver damage. Excessive alcohol consumptions can lead to that. Respiratory issues, those that smoke, they use cigarettes to manage stress and anxiety, but the health implications, it leads to COPD, lung cancer, and then addiction. Physical dependency on substances can also deteriorate our health. In addition, sleep deprivation. Sleep deprivation also causes cognitive impairment, poor memory and concentration, weakened immune system. This leads you to be at increased risk for infections and metabolic disorders, higher risk for obesity and diabetes, as I already mentioned. And next slide. Okay, more impact of stress and anxiety. Now we are focusing on the mental health aspect. Chronic stress, anxiety, and depression. Persistent stress can lead to that. Anxiety disorders and depressions, these things are real that people deal with. Sleep disorders, insomnia, and sleep-related issues, and burnout. Chronic work-related stress leads to emotional and physical exhaustion. Mental health disorders, depression, persistent sadness, loss of interest, and physical symptoms like fatigue, anxiety, anxiety disorders, excessive worry, panic attacks, and phobias, as well as bipolar disorders, extreme mood swings from manic highs to depressive lows. In addition, social isolation, impact of stress and anxiety. Some people may isolate themselves. This can lead to loneliness. It can also lead to cognitive decline in older adults, especially, and poor physical health, high risk for chronic illnesses due to lack of social support. We are human beings and we need social interaction. And when you remove yourself from all this, you are at risk for many, many health issues. In addition, traumatic experiences, PTSD, this one, severe anxiety, when you have flashbacks related to something traumatic that's happened in your life. And substance abuse, as I mentioned, people use it to cope with trauma. Interpersonal issues, difficulty maintaining relationships and stress. So it affects every area of your life. Next slide, please. Let's discuss mitigation strategies for the healthy lifestyle. When dealing with anxiety and stress, you can exercise anywhere, even 20 minutes a day of exercise or 152 minutes per week. That helps. Balanced diet, nutritious and proper hydration. That also helps. Trying to get enough sleep, adequate sleep, maybe 7 to 9 hours if possible. Realistically, we all work. We have family that we take care of. So many times it's hard to get that much sleep unless you're off from work. But, just try your best to get some good sleep. That helps. And for mental health care, therapy and counseling, we have to accept that these things are normal. And people struggling with stress and anxiety that are not able to manage it from other techniques that they've been using, they really should get some therapy and counseling, professional help. Talk with someone, even if you, after talking to your parents, for the youth or family members, and you still feel like you're struggling with anxiety and stress, be honest and open to family members and seek professional help. And stress management techniques like meditation, exercising. Some people use music, they meditate, and that really helps them deal with that. Social support. Make sure that you have a supportive social network, maintain that. That can help you with managing stress and anxiety. In addition, avoid using harmful substances to cope. Alcohol, cigarettes, smoking, anything that's not healthy. You don't want, even overeating. You don't want to use all these things to cope with stress and anxiety. If you're going to drink, moderation, alcohol consumption, moderation. And for people that smoke, there are resources out there to help you to quit smoking. It's an addiction. So you do need to get some professional help or resources. So understanding the interplay between physical and mental health is crucial for overall well-being. By addressing both areas holistically, we can improve the quality of life and reduce the risk of chronic illnesses and mental health disorders. The negative effects can lead to poor academic and professional performances for people that are in school, high school, college, especially. All these can lead to poor performances if you do not address the stress and anxiety healthily. Addressing stress proactively is crucial for maintaining both mental and physical health. And by recognizing and managing it early, we can prevent more serious issues, as I've discussed in this presentation. So recognizing that something is wrong and addressing it will really decrease you from escalation and getting all these serious health issues that can occur. Proactive stress management strategies, exercising, adequate sleep, as we discussed, all these things help. Reducing stress can lead to improved cognitive function and decision-making abilities, allowing us to navigate challenges more effectively and maintain a higher quality of life. Next slide, please. Okay, so let's discuss strategies for managing stress in life. As I mentioned, prioritize self-care. Let's try to exercise, eat healthy, get enough sleep if possible. Let's practice mindfulness and relaxation techniques. Let's set boundaries and learn to say no when necessary. This is very important. You cannot fix everyone's problem in life. So, you have to learn to say no and build a social network and seek help when needed. Take a moment and think about what has worked for you, when you're dealing with stress and anxiety from work, any area of your life, what has worked for you in the past. Next slide, please. More strategies, this time strategies for managing stress in school. For our high school and college youth, time management, as you probably already know, is very crucial in meeting deadlines. Prioritize your tasks, create schedules, create to-do lists, utilize all the resources you have to stay on top of things while you're in school so that it doesn't become overwhelming. Break tasks into smaller, manageable steps. Develop effective study habits and seek academic support. Use all the resources that the school or college has to offer. Seek help from friends, but just do not procrastinate, because doing that will lead to stress and anxiety because you are rushing to finish everything all at once. Practice stress-reducing activities such as deep breathing and meditation. So take a moment to think about what has worked for you. For those that are in school, any of these techniques have worked for you. Next slide, please. Okay, let's talk about strategies for managing stress at work. Again, you can use a lot of the techniques that you use for school at work. Organize, prioritize, and at work, communicate openly with your colleagues and supervisors. Take your breaks. As busy as it is, just make sure you take your break, and avoid overworking yourself. Seek professional development opportunities to enhance skills and confidence. All this, having confidence in what you do at work really helps a lot in avoiding stress and anxiety. So you can take a moment to think about some that has worked for you at work. Next slide, please. Okay, let's discuss coping with anxiety. Okay, you need to first identify the triggers. Okay, what is making you anxious? You got to listen to your body. You need to be very mindful and be very attentive to yourself. If you do something and you know that it makes you anxious, then you know that this thing makes me anxious. So you need to develop coping mechanisms. Okay, challenge negative thoughts and practice positive self-talk. You have to, for our youth in school, especially, just really be very mindful about your thoughts. Sometimes the way that you're thinking about things is in reality. So you really, or how the negative talks that you, self-talks that you have, it's not real. So you need to really be aware of these things and practice positive self-talks. Utilize relaxation techniques such as progressive muscle relaxation or visualization. Consider therapy or counseling for additional support. Next slide, please. Okay, in conclusion, stress and anxiety are inevitable parts of life. They do not discriminate, as I mentioned, but they can be managed effectively. By implementing proactive strategies and seeking support when needed, individuals can maintain their well-being and thrive in various aspects of life. Managing stress and anxiety is crucial for success in all parts of our lives, including school and work. So all the techniques that I have discussed, all these techniques, mindfulness, practicing mindfulness, relaxation techniques, healthy lifestyle, eating well, exercising, trying to get some sleep, seeking help, social support, professional help, all these can help you in dealing with that. So it's essential to find what works best for you and to incorporate these strategies into your daily routines to achieve success while maintaining your well-being. We think about some ways that you individually manage stress and anxiety, especially the youth. My personal own way is through prayer. I used prioritized praying to manage stress, anxiety, all my emotions, and everything that life throws at me. I find this to be very helpful, and I recommend it to anyone, the youth, parents, everyone. Prioritize praising your rosary, as Father Apia emphasized yesterday in his presentation. We are Catholics. We need to really prioritize praying the rosary. And I encourage all youth and young adults to pray your rosary every single day. If you can't pray the whole rosary, pray a decade or 2 decades, but you need to be praying the rosary. And this is very important in eliminating stress and anxiety and everything that life throws at you, especially for our youth who are in school and dealing with so much peer pressure, so much in school. The world is changing. So please, please prioritize praying and using your rosary. All right. And that's it. Thank you for your time. That's the end of my presentation. You can get a copy of it. Brother Felix can share. If you have any questions, you can let me know. Thank you for your time.
Thank you very much.
Thank you so much, Sister Gifty. So the floor is open for questions, comments, personal experiences that you want to share with the rest of us. So
this is Joe. Joe, I have a question. So, Sister Gifty, can somebody suffer from mental health to the extent that we say it's a disease, like this person is suffering from mental health disease, or we don't have anything like that? And if there's a disease, can it become chronic? Like, can it become like every time, like the person suffers from that problem, or it's something different?
Oh, absolutely. And any one of us can get mental health problems. A lot of my patients that I take care of, they are doctors, lawyers, and some of them don't even have family history of mental health illnesses. But one day at work, some of them are at work and something would trigger them. And that mental health problem just goes into effect, and it affects their whole life. So now that something has triggered a mental health illness, it's not going to be curable. They have to seek professional help. They need to have medication, be on medications depending on the severity or what type of diagnosis they have. So, they have to be on medications, and, this is lifelong when you get these illnesses. But anxiety and stress, people can manage it without medications by, all the things that I spoke about, as well as um, talking, counseling, talking with people, but mental health illnesses, there are so many, many different illnesses out there that are chronic, and you deal with that for your whole entire life. You have to be on medications. If you are in denial and you don't accept the medications or the treatment that they have prescribed for you, the symptoms that you're having are not going to go away, and they will even get worse, and it will lead to even more horrible things that will affect your health. Hopefully that answered your question.
Yes, it did. And a follow-up, so do we have mental illness that are genetic, like, or that are hereditary, that are passed on?
Absolutely. Yes, absolutely. A lot of my patients with schizophrenia, they have family members that have had it, and that some of them get it when they're very young, but there are times where some people get it in their old age, but then when they dig into their family history, they realize that they have some family members that have that, even bipolar. So a lot of it is genetic. So
All right. And last one, do you suggest that we go for random checkups, or what do you suggest to that?
absolutely. I think that everyone should prioritize their mental health. We don't talk about that enough. Mental health is so crucial and important, and people are suffering alone. People are dealing with so much in their head. People are dealing with things secretly, depression, and they don't have anyone to talk about because of fear of being judged, or fear of what other people are going to see them, perceive of them. So if you have family members that are open-minded and really give you that support, that's wonderful. But there are some people that, family members will gaslight their feeling. They will not acknowledge that they are depressed when they really are depressed, because depression is real. So those people need to advocate for themselves and seek professional help, even if they don't have the support of their family, because at the end of the day, it's your health. You're the one dealing with this in life. You're the one dealing with those feelings. Nobody else is dealing with them for you. So you have to advocate for yourself and seek help.
All right. Thank you so much.
Mm-hmm.
Sister Gifty.
Yes, Sister Veronica.
Good job, by the way. Anyway, so I have a question. I'm picking back off what you said. So
Yes.
there's a huge stigma associated with like mental health, right?
Mm-hmm.
So if you're suffering from mental health and like you are afraid to come out to your family, because again, we are Africans and that is not really something that is welcomed. Is there any like helpline or resources that the person can go to?
Absolutely, there are. Remember, I mean, a simple Google search will provide you so many resources, but please, I will share that with Brother Felix. We can add that to the platform. I don't think I put any numbers there in my presentation, but absolutely, I'll share some of those resources. And yes, I'll share some of those resources. But yes, you're absolutely right.
Thank you.
Just to add to what the issue of stigmatization on mental health among us Africans, is there, how can we, reach out to the wider community at church? Because I know today's presentation has been helpful, but if it is possible that maybe we can work with the other leaders of the, various societies, and you can have, opportunity to do the same presentation with them and kind of like make them aware that these things are, normal, and we can't, stigmatize, and so that at least we can have other people be aware of the information that you have given to us.
That
So these are
sounds
some of.
great. That's great. Yeah. Communication. Absolutely. Yeah. Um, we must communicate these things, and we must stop the stigmatization on mental health, especially with the youth. It's very important that we allow them to know that whatever they're going through, we are open and we are ready to listen and to help them without judging them. We need to validate their feelings. And it's not just the youth, grown adults, we all deal with some form of issues it, due to the stressors of life. So we can acknowledge that. Let's be open and let's share and help each other without judging, one another, because we are all humans and we are all susceptible to so many things, including mental health issues. And we should not be judged or discriminated against because of that.
Hi, Sister Gifty. This is Benedict. Thank you for your time and your presentation. I have two questions. My first one is, how do you politely and effectively point out to somebody that they are stressed out or they need professional help?
You do that by in private, okay? Reach out to the person in private. You don't need to do it in a way that will shame the person. Maybe you can take the person out or invite the person for one-on-one. It's best to do it in person, where you make eye contact with the person so they can see the sincerity, than on a phone or over a text message, because that can be it can be your sincerity can be miscommunicated. So if you have a one-on-one, you do it with a one-on-one approach and just keep trying. Don't give up. If initially the person is defensive and the person is like, well, what are you talking about? Who do you think you are? Still try, try to get the person over and over again and show that you really care. And I think that when the person sees the efforts that you are putting in, they will reevaluate some things and they will get the help that they need. But don't be shy from approaching anybody, especially a church member, but just do it with respect and in privacy and, dignity. Just don't make the person don't shame the person, because that's not going to be helpful in any way.
Thank you. My second question, you mentioned, the praying the rosary, which aside from its spiritual aspects, has this mindfulness and relaxation techniques. What other relaxation and mindfulness techniques do you recommend?
Some people like to read. Please read your book. Find out what works for you, because, everyone has that individualized healthy coping things that work for them. People, relax by reading. People use music. I'm a big music person. So me, praying and music are my big two. People relax by reading the Bible, going to church physically, being in a church setting. And some people relax by talking to friends, family members, getting a body massage. Utilize all the options, the healthy options that you have. Don't just stick with one thing, because, music and prayer may work for me, but it may not work for everyone. So find that thing that works for you. Although I do recommend everyone pray every day. But yeah, find out one thing that works for you, or several things that work for you, and use that in a healthy way to help yourself, and be honest about if it's helping you or not, and try many different techniques. Don't just stick with something if it's not helping you. Try other things.
Thank you very much.
Hello,
Yes.
Gifty. This is Helen.
Hi, Helen.
Maybe I missed something. I just want to know, how can, for instance, I'm using myself an example. If I want to know if I have anything kind of related to any mental issue, How will
Okay.
I know? Thank
All
you.
right. Well, you have to assess yourself. Do you just assess yourself on a normal, is there something going on with you? Have you been feeling um very emotional? Have you not been eating? Have you been feeling like fatigue? You just don't have interest in anything. You have to first assess yourself to see what symptoms you're having that is not within your normal self. And you know who your normal self is. When you are your healthiest, you know who you are. So when something is out of place, you know it, you feel it. So acknowledge those things, you know, and you can try some of the steps we talked about: praying, exercising, making sure your diet, the foods you're eating are right, avoid processed stuff. And if you feel like, no, this thing is going on for too long, I don't feel like myself, you have insurance, you need to book an appointment. Send a message to your doctor. These are the feelings I'm having. Um, Talk with someone like professionally. Go and talk with someone professionally, a counselor, and they will be able to help you navigate those feelings and create like individualized plan for you for whatever you're feeling. It could be something small, or it could be that you do have something that you need medications. You need to be on medications, if depending on the severity of how it's affecting your life.
And if you don't have an insurance, what do you do?
They have some resources. I will send some numbers to Brother Felix. But like I said, if you go on the internet and you Google mental health, thankfully the United States is very big on mental health. So even without insurance, they do have resources to help you. I get a lot of patients at work who are homeless, they don't have insurance, and we provide them with mental health services. The government helps them. The state of Virginia covers that. So even if you don't have insurance, please, there are resources out there. I'll give some number to Brother Felix, and you can always Google search. They have resources available depending on where you live, and that you can always get some help.
Thank you.
You're welcome.
Hello, Star Gifty.
Yes.
Yeah, this is Akuya. I wanted to ask where you do work, because maybe we'll feel comfortable coming to you than maybe going to another place. If that's what.
Yeah, thank you. I actually work in a mental health facility. It's a state facility. It's called Northern Virginia Mental Health Institute. And that one is not an outpatient place. This is inpatient. So unfortunately, I wish I could be available, but I'm a nurse and I take care of patients from prison, homeless people, people with mental health issues. But you have to, it's inpatient, meaning you stay there. You sleep and stay there. And the length of time you stay there will be determined by your doctor and your team, but depending on what insurance you have. I've had many Ghanaian patients, Sierra Leoneans, Nigerians, Ethiopians. I've had a lot of Nigerian doctors that came to this country, became doctors, and they had that trigger that caused them to have a mental illness that they could not treat themselves, and they needed professional help. And I've had some of them come and stay for 2-3 months. They are put on medications, they're treated, and they're stabilized. They are not cured, they're stabilized, and then they are discharged with a plan on how to live life independently while managing that mental health illness. And obviously, a lot of them will have to be on medications for the rest of their lives. So even though I'm not available for you to come to me, I'm always available as a church member. If you have any questions, you need any support, I can give you some guidance on where to go and what to do.
Yeah, Sister Gifty, this is Benedict again. As youth, how best can we approach our parents to have this conversation with them, about stress, anxiety, and mental illness?
Yes, I think that number one, we have to be respectful about it, how we approach our parents, because, a lot of them are not educated on that, that area, because, they grew up differently than us, especially if they are raising us in America. The things that we go through here is completely different from what they had to go through in Ghana, so just approach them with respect. Don't be loud about it or demanding about it. Try to also realize that even though you are going through something, they also need to understand. They're also going to try to understand what you're going through, even if it doesn't make sense to them. So just try to approach them when it is the right time. When Try to approach them one-on-one, be sincere, write a letter for them, let them know your sincerity. Mom, I need help. Don't joke about it, or don't yell about it, or show attitude about it. Even if you have to show some tears for them to see the seriousness, just really try to get them to understand that something is going on with you, something is wrong, that the prayers you've been praying, going to church, but you need professional help at this point. All that work and help, but you need professional help, and you want them to help you, So try to keep approaching them. And like I said, if they're not taking you seriously, seek other people. You have other family members. If your parents are not accepting it, they're not believing that you generally are depressed, and they think that it's just in your head, and you don't need to talk to anyone. Talk to a different person, your uncle, an aunt, somebody in your family has to take you seriously and help you get the correct help that you need.
All right. Thank you. I know some of our parents are also on the line right now. Can you also give them an advice on how they can also respond when our younger brothers and sisters approach them to tell them about the problem?
Yes. So, our parents, we beg you, when we approach you with how we are feeling, we know that sometimes it doesn't make sense. But we just want you to be empathetic, try to be open-minded, because the way that everybody deals with situations differently, the way that you would deal with losing someone you love, it's not the same way that maybe your daughter will be able to deal with it. If a family member has passed away in your family, how you will be able to deal with it. Maybe the way that your daughter is dealing with it, her feelings are completely different. It's heightened. It's really she's struggling. So when she comes to you, we beg you to be understanding and open, so that we don't have to hide things from you, so that we know that our parents are there. They are there to listen, even if they don't know the solution. They're there to help us find a solution. They're there to help us talk to the pastor or someone to guide us to find the proper solution for us, because everyone is an individual and we all deserve to find the proper treatment or help. Because life is hard and everyone copes with things differently. So we have to acknowledge this. So our parents, we just beg you to be patient with us and to understand that we are all individuals. Even if our siblings are dealing with things normally, it looks like they are fine. And we are the ones dealing with things differently. Our emotions are different. We are telling you we are feeling depressed. Please don't gaslight it. Don't tell us that we don't know what we're talking about. Please don't shut us out. Please try to be understanding. Just listen to us. And if you don't know what to do, just try to get help for us.
Thank you very much.
I have a question on the issue of medication. It seems a lot of us find it, difficult to accept the fact that certain mental health issues, or issues of anxiety and stress, we can medicate it. Is there an alternative way that people are not really comfortable because people are so concerned about the long-term side effects of these medications? Would you recommend certain lifestyle changes that can also help us to deal with these issues?
Yes. Anxiety medications, dealing with anxiety. Some people don't even need medicine for that, honestly. Exercising, like I mentioned, healthy diets. Your diet is very important. Getting enough sleep, talking to people. Don't isolate yourself. Speak, have friends, have people you can talk to, go to. Don't isolate yourself, because that's not going to help you. But if it depends on, does the benefit outweighs the risk? Everybody deals with it differently depending on the severity of your anxiety or stress. Some people need medication. The medication has more benefit for them than the side effects. Even though every medication you take comes with side effects, benefits outweighs risks. So sometimes the benefits you have from the medications is better than the side effects that you're worried about. So you do need to be on medications. And sometimes you don't need to be on medications by making lifestyle modifications, exercising, watching your diet, getting enough sleep, using all these resources you have, sleeping, talking to people, being very open about what you're feeling, praying, reading your Bible. A lot of times these things help you without having to need medications. But we have to be honest with ourselves, especially with anxiety and what it can lead to. We have to be honest with ourselves. And when we know that all the techniques we're doing is not helping, maybe we will benefit from the low dose medication, starting from the lowest dose, something will help you more to deal with that.
Okay, thank you. And I noticed somebody raised their hands in the chat. So if you raised your hand and you have any questions or comments, you are welcome to do so.
Yes, I did.
Yes.
I just want to find out if the symptoms are the same for all the ages, like the young ones and the adults. Are the symptoms the same?
Symptoms are very individualized. So the young ones may have some symptoms that the elder ones may also experience. But then again, like I said, everyone's symptoms are different based on how they deal with things that happen in their lives. But for anxiety and stress, those symptoms are very, very much the same for all age groups. We all, feel overwhelmed, and we feel our heart rate is racing when we are stressed, and we are anxious, So all those things are the same. But when it comes to mental health illnesses, bipolar, depression, all those things, it's individualized. Not everyone's symptoms will look alike. The younger ones may be different from the older ones. Our parents were raised in Ghana, so they deal with things differently in life. They don't talk about their feelings, but sometimes they're dealing with things, but they don't talk about it. But the children, they can't handle it like how the parents can. Some things that the parents can just go through life and just ignore it. it's not the same for the kids. They need help. It needs to be addressed, whatever they're feeling. So to answer your question, the symptoms are individualized, meaning that your child may be having different symptoms than how you would deal with it if you have anxiety. So
Thank you.
Sister Gifty.
yes.
So, okay, so even though like the symptoms are individualistic, is there like a particular signs that you may recognize in children that may alert the parents to, okay, this is serious, we need to take action?
Of course. You know your child and you know when something is different. So we ask the parents to be very observant. We know that our parents are very busy. A lot of them are working 2 jobs. They're trying to take care of the family. We know that and we acknowledge that. But we also plead with you to be very observant of your children, because you know when something is not right. Your child that is sociable, happy, if they start being withdrawn, going in their room, locking their doors, if they start not talking to you, isolating themselves, that something is wrong, so our parents need to address that. Our parents need to reach out to them and try to do it in a very less aggressive way, with compassion and with empathy, so that our children will feel their children will feel comfortable and safe in sharing what they're feeling or what's going on. So absolutely, when you know your child and you know when something is different and the way they're acting, it's abnormal, it's not their norm, what they normally do. So if you notice the way they dress, if you see that your child is dressing differently than how they normally do, something is going on, that you need to address in a calm way. That you don't have to be aggressive about it. I think that we can all just you can try to communicate with your child so that they can be comfortable in sharing what's going on with you.
Thank you.
Right, Betty. One thing, especially as a young child is transitioning to adult, that kind of transition.
Yeah.
Can a parent like Mr. understand that to be kind of some mental something is happening to the kid? Because I am thinking at times when we don't approach this thing in the right way, we rather push them further.
Away.
Yeah.
That's right.
So
That is very true.
what can you say to help us as parents or young parents that have children trying to go into this kind of transition, when they are getting to their puberty, these changes in their bodies, and
Right.
boys have different aspects, the ladies have different. How can we approach it in the way that we will not rather push them away
Away.
instead of
Right.
drawing them closer?
Yes, and that's very true. When they are going through puberty, emotions changes, a lot of things change within them that parents will start to see. So let's approach our children with love. Let's not be so aggressive about how we approach them. Just you need to have one-on-ones with your children, one-on-one sessions with your children. It's okay to hug your kids, and it's okay to kiss your children. We need that. We want that. All these things matter when you're raising us. It makes us feel comfortable to come to you, and we don't have to hide anything because we fear that you are going to yell at us or beat us. We have to be able to feel comfortable to come to you. So the parents, we just ask you to please approach us. Don't ignore it. Even if you think that what's going on, you can't handle it. Initially, you have to attempt. You have to attempt with softness. Try to have a one-on-one with your son or daughter. Talk to them in their bedroom without any judgment, criticism, without without any it sounds like you are lecturing them, advising them. Just hear them out. Let your children feel like they can talk to you. They can share their feelings, even if those feelings you don't agree with. Just let them share those feelings with you, and then you can decide on how to address those feelings that your child has shared with you. And parents also have to be honest with themselves when they need help. You can get help from another parent, or you can talk to the, you can get them professional help, church leaders. Just be honest about it without shaming your child, or, without being judgmental. Just be very honest about that. When you need help, parents, please get the help. If you feel like you can't address the problem by yourself that's happening to your child.
Right. Thank you. Mr. Prince, your hand is up. Mr. Tete.
I think he already has asked his question.
Yes.
I know it's up again.
How electronic devices have either contributed to the problem or helped in solving this problem?
Electronics have definitely contributed to the problem. Yes, absolutely. Social media, long hours of using electronics. They're on YouTube. If you're not monitoring what your child, especially if they're young, starting from a very young age, we have to monitor what they're watching, because they learn things, and then they compare. When they see what's on social media, they compare. They learn new attitudes. They learn new words. They learn negative things from social media as well. So, from the jump start, if you're going to give electronics to your children, there has to be rules that everyone is aware of. Parents have to set the limits. Everyone, in an open way. Let's set the limits for the kids so that they don't get addicted to the electronics, because they do have negative impacts, and that's the honest truth. So absolutely, parents need to be very careful with how much they allow their children to use, depending on the age, to use electronics, to be on the internet for so long, YouTube. Sit and watch whatever they're watching with them. If you have time, watch one of the shows that they watch. Show interest in what they're, and then look at, so that you can see exactly what they're watching, if it's appropriate or not, and then you can set that limit with them and have the conversations that you need to have with them.
All right, thank you, Sister Gifty. Sincerely, I'm particularly enthused about this topic. Honestly, in our part of the world, these things are not highlighted. I've come to realize that some of the mental health illnesses that are more pronounced in this jurisdiction is more or less when it happens in our part of the world, people associate it with spirituality.
Yes.
And at the end of the day, I don't know how to describe it, but it's killing our society.
Yes.
And so I want to thank you very much. I've been quiet and listening and soaking in whatever you are giving us. These are good stuff, very wonderful teachings that you are taking us through. We appreciate that. But my question has to do with when you talked about our parents, and particularly they were brought up from different backgrounds, when they transition to the States, they still have that mentality. And like you said, they go through serious things and they don't have that confidence to share, even with their own children and close family ties. How can our parents, overcome, such situations so that they can seek help and redress? Thank you.
Okay, thank you so much, Brother Chumesi. And everything you said is right. So for our parents, it all boils down to them being just assessing themselves and realizing that they need help. And how would they know that they need help? Education. And then church members, we see people and we see that something has changed. Let's reach out, let's bring the attention to it. Maybe some of them are not doing the proper assessment, self-assessments. And even though they're going through a lot, they won't ask for help. Let's be the ones, if we notice that they need help, let's be the ones to reach out to them in privacy, in a respectful way, confidentially, and then try to get them the help that they need. Because some of them will still be in denial, they will keep hiding what they're going through. But we hope and encourage them through education, and giving them some resources, and showing that we care, reaching out to them. Maybe all that can help in letting them be open with us and letting us know that they need help so we can actually give them the help that they need. And children can also assess their parents. You know how your mom or dad is on a normal basis. So please also I know it's not your job, it's the parents' job to take care of you, but when it comes to mental health talks, it doesn't discriminate mental health issues. So you know when your mom seems very stressed out or different. You know when your parents seem different. So you also need to bring their attention to that so that they can get the proper help they need. Or if you think that they are neglecting their mental health, and reach out to a family member, a close family member, confidentiality, and just let them know that something is not okay with mom. Children can also advocate for their parents so that your mom or dad can get the help that they need.
Thank you.
Thank you.
I have a question on this, Benedict, the electronic and social media use. What do you think is the appropriate age to start giving children electronics?
That one, dear, it's really that's a decision for every family to make, honestly. Even some families will give their children a cell phone at a very young age because they want to be able to call them on FaceTime or reach them when they are not with them. But it's based on the family. It's a discussion that you have to have as a family. But for me, I think that iPads and tablets for the young ones, once they start school and they are learning, because there are some educational apps that they can utilize iPads for, that they can download and learn educational stuff on YouTube. But once again, you have to be monitoring them to make sure they're using the iPads correctly. So once they start school, kindergarten and all that, you can let them use it, but you have to put parental control on it when they are that very young, so they're not able to search outside of what you want them to search, or the programs that you've downloaded for them to play. That's what they can use. So from the very young age, if you decide, and it's a decision that you will have to make as a family. Every family is different. One thing may work for you, but it won't work for another family. So that's a personal decision. So once you do decide at a young age, if you do want your children to start using the iPads, we have to monitor and we have to put parental controls on it.
All right, thank you.
We still have a lot of time for questions, contributions, comments.
So this is Joe.
Mhm.
Do you think that society, when I talk about society, like the nation or the church community or like our neighborhood, our schools, do you think that science societies have failed in the fight against mental health? Because for some of us, sometimes some of the things that we are hearing, it's like we are hearing them for the first time.
Mhm.
So do you think that society has failed, in the fight, against mental health?
Yes, I do. I do not think that society prioritizes mental health at all, at all. And I think that, especially as Africans, as my brother Chumesi mentioned, we are very quick to blame it on spiritual stuff, when somebody is dealing with mental health crisis or going through things. But in addition to praying and all that, we need to seek professional help when we know that the person needs professional help. But we have failed, absolutely. Mental health is so important. And when you start to prioritize your mental health, in addition to, your spiritual life, praying and all that, reading your Bible, you realize that it really works hand in hand. And things that we gaslight about, our children when they're going through crisis and they start at a young age, we gaslight about our feelings, how something affects someone. We shouldn't do that because it's not helping. You are normalizing people to see mental health issues as not a problem. And in the end, it will eventually affect you in a negative way that if you had addressed it from the start point, it wouldn't have had to escalate to the point where you can't really help yourself anymore. So we don't take mental health issues seriously, especially depression. People deal with depressions. Those are real things. Your feelings are valid. Whatever you are feeling, going through changes, life changes or death happening to your family, loss of job, a lot of things can happen in your life that you will feel depressed. Sadness is different from depression. Depression is when you've been sad for a long time and it's affecting you. You're not eating, you are not, you don't have energy for anything. You just want to lay in bed all day. That's not normal. If you finding yourself, you're hiding from society, laying in bed all day, isolating yourself, sleeping a lot, you don't have energy for anything, you need to listen to your body. That's not normal. You do have something going on with you and you need help, you know. So we hope, we hope that mental health will be taken seriously. The United States does a better job, obviously, addressing this than Africa. But now, mental health talks have been increasing in Africa. People are talking about it more and more. So the hope for the future is that all the countries in Africa, we will start to take mental health issues seriously, and we will acknowledge that these are real things and it's not just spiritual things, and that we will get the help for our family members the help that they need, and for ourselves too. So that's the hope. But right now, no, we have failed as a society in addressing mental health issues. It's an ongoing battle. So Hopefully in the future, we hope and pray that there will be better, people will take it more seriously, and there will be changes, more effective changes in addressing mental health issues all over the world.
Yes, Auntie Gifty, this is Helen again. Quick question.
Yes.
Do you think one can get themselves entangled with mental health issues through some of the medications we might be taking, like overdoses and maybe
Mm-hmm.
abusing drugs, like smoking
Mm-hmm.
marijuana, even
Yep.
though you don't have it in the family as a
Yes.
youth or an adult? Do you think getting yourself into this kind of
Mm-hmm.
habit can cause you your mental health?
Yes, absolutely. Thank you for that, Miss Helen. Absolutely. Drugs and alcohol, abusing these things, especially marijuana. I've had patients who have who tried marijuana one time. They didn't even do it for that long. They took like 2 puffs or whatever, and immediately the way it affected their brain was so dramatic, because everybody's body is different. Some people will smoke marijuana every day of their lives and they will not get mental health issues. It will affect their life negatively, but you don't know how your brain will tolerate substances, especially alcohol too. Some people can go their whole lives and drink, and as long as they're drinking in moderation, and it will not affect their mental health in a negative way. But some people's brain, chemistry, alcohol can trigger you, can affect your mental health. It can give you all these diseases that you did not think that was possible. So especially marijuana, that one I've seen, it's very powerful. Many of my mental health, my patients that are coming from the street, they have marijuana in their system, and hopefully the youth will be more aware that maybe they think they're just doing it for a short amount of time, peer pressure, whatever, but there are serious consequences. Trying or experimenting with marijuana, drugs, and all these things, they can affect your mind, your mental health. They can cause you to have illnesses that you need to be put on medications for, that it's not reversible. So, because everybody's brain is different, and how everybody's body reacts to substances is different. So maybe you are the person whose brain will not be able to tolerate it, and now you have to deal with mental health illness your whole life, because that triggered your brain activity to spiral out of control, and now you are being put on medications to stabilize you. So definitely the children, your children, the youth, have to be understand the seriousness of it, of staying away from these substances, the marijuana, the drugs, alcohol. Just stay away from all that.
Thank you.
It's now 8:21, and we were supposed to close at 9, but I think we can close earlier than that. So we have 9 more minutes, and giving people the chance to come up with their questions, comments, contributions. And also, we want to run a few more announcements as we go through our week. So tomorrow, just a reminder, tomorrow we'll be having our rosary prayers and then the praises night with a charismatic group. And it starts at the same time, 7 p.m. It's going to end at 9, and it's going to be on the same Zoom link. And then on Thursday, there's a slight change in how we want to organize our quiz. So the initial plan was to have 2 contestants, one from the male side and, 2 from the male side and 2 from the female side. But looking at how things are, we are aiming to have it between just males and females. So tomorrow we are going to post the study materials. So Father has already said the questions and the areas that the questions are going to come from. We post it on the platform tomorrow. So the contest is going to be between the men and the women. That's going to be on Thursday, same time. And then on Friday, we're going to have our moving nights at our parish center. And it starts at 7 and closes at 9. And we encourage people to bring, their own snacks. We are going to be providing snacks, pizzas, drinks, popcorn. But if you have any special kind of snacks that you enjoy it whenever you're watching your movie, you're welcome to bring it. And if you want to share with us, that'll be lovely. And we are also encouraging every one of us to invite friends to come and join us. Are there any announcements that I'm missing? Kofi, Phil, Joe?
Saturday.
Oh yes, Saturday. Yes, Saturday. Saturday morning we are visiting Catholic Charities in Manassas. We post the address on the platform. That is going to be at 9. And then after that, we will go to St. Anthony in First Church for our games and then cookouts. And depending on how your commute is going to look like, I suggest that you pack, if you have to pack your wear, you have to pack your soccer cleats, whatever, because for some of us, it might not be possible that right after we leave Manassas, we cannot go home and change. So just so we are aware of it, the time stamp between leaving Manassas at 9, we'll be there at 9, and we don't know how long they might need us at Catholic Charities. Hopefully we can get off on time. That will give us ample hours between that event and going to start our games at 2. But in case that we get hang on with the time in Catholic Charities, we suggest that you pack your, whatever you want to use for the games. Also, if you have any board games or indoor games like Scrabble, Jenga, Ludo, or Ware, please bring it along. We also encourage you to bring people as well, so that the games can be more fun. And come prepared to don't come expecting to be a spectator. Everybody's going to participate. So just come prepared to exercise, work out, socialize, eat. Hopefully there will be enough for takeaways.
Yes, Ryan, your hand is up.
Yes, so for Saturday, in the platform, can you put the address?
Sure.
Thank you.
You're welcome.
And my other question, so that Saturday we're bringing the snacks to
Yeah, right. So Joe will call you.
Oh, okay.
All right.
Yeah. So just to clarify, the snacks are going to be on Friday. But if you also want to bring snacks on Saturday, that's fine with us. Because I know we put a survey on the platform and requested, if people had any kind of snacks, finger foods that they could bring. So yes, we are open to, people bringing their own snacks on both Fridays and Saturday. But on Saturday, the majority of the food is going to be catered for. We have lovely ladies who have volunteered their precious time to cook for us. So, and in due time, we are going to acknowledge and, show our appreciation to them.
Yeah, and the quiz on Thursday, it's, as Teddy said, it's between the men and the women. Everybody will have the chance to answer a question. So you don't come and be a spectator, like expecting someone to answer it. It's between all of us, like men and women. And as you said, we didn't get the participants that we're looking for. We didn't get them. So now it's open. When the question is thrown at any gender, anybody can answer. So don't think that, for media, I'll just come and listen to it. No, everybody will have the opportunity to answer a question. So the material has already been posted. So let's study them, then come prepared on Thursday.
Yes, Sister Gift is up.
Yes. Brother, have we decided on the movie that we are watching for the movie night? We are still doing it on Friday, correct?
Still on Friday. And most likely it's going to be War Room.
Okay.
So the parish center is the building on the other side of our church. I think there's a school over there. So that's where the parish center is, for those of us who might not be aware.
Yeah, for the quiz, the Genesis. Can we have the chapters, or we are going to read all Genesis 1 to the 50?
Where it says the life of Joseph in Genesis.
So give us where to read, please.
So the father is also giving you an assignment. So find in your Bible where the story of Joseph is in Genesis.
All right. Okay.
What? Where the spirit of what?
Where
I'm
the
sorry.
story of Joseph.
The story of Joseph.
Oh, okay.
I think I've already sent that chapter out. I'll look for it again and resend it. I think it's chapter 3 or something. I'll just find it and resend it.
The story of Joseph.
Yeah.
And Ruth. So we're reading all the book of Ruth, right?
Auntie, and you want an easy win.
Oh no, I'm making it easy for everyone, please. Please. Look at you.
Yes, we will post the study areas on the platform.
Okay.
We'll get them posted on the platform. And I know there's a section that is for Catholic doctrine. So
yeah, round one.
Round one is going to be Catholic doctrine. So, nice opportunity for us to go and learn about what the Catholic faith is.
Can you please post it tonight? Because you guys are trying to beat the females. We don't have access to like what you put earlier.
Chat right now.
Okay.
So we young adults like Vita Frimpong and Anne and everybody are going to be part of this. Are you going to be
anybody that is on the line that is a female, when the question is asked for female, can answer.
Okay.
You keep answering till your timer is off. If you get it wrong, you still keep answering till you get the right one. When your timer is off, it's off.
And how long is the timer?
When we get there Thursday, we will know the timer.
30 seconds.
That's too long.
So it's 37 to 34.
Genesis 37 to 30.
37 to 40. Sorry, 37 to 40.
Okay.
Yes, 37 to 40.
And then Ruth, and then the book of Ruth.
Yeah, for the whole Ruth. Yeah.
Yeah, for Ruth, the father didn't give a specific chapter.
I think it's 1 to 4, right?
So I guess learn the story.
1 to 4.
Please, ladies, come prepared so that when the guys, you don't say that we cheated. Please come prepared.
Don't worry, the ladies are going to defeat you.
Don't worry.
No.
We will come prepared.
Okay, brethren. Especially this is the program outline for God willing tomorrow. The charismatic renewal will host the youth and the young adults. It starts at exactly 7 p.m. Respectively, we are time conscious. We start at 7 o'clock on the dot. When we come and there's 5 people on the line, we will start with the welcome and opening prayer. Sister Helen will lead us the rosary prayers. There will be 15 minutes of praise and worship. There will be exaltation by the national coordinator of Catholic Charismatic Renewal in North America, Dr. Samuel Ewua. And then we will have a general intercession and petitions. and then we'll close by that. So I'll post the outline on the youth platform as well. Thank you.
Thank you, Mr. Chumesi. Does anyone has any